Welcome to the International Translation Health Store. My name is Richard Spencer and today, we're discussing gastric ulcers. What causes gastric ulcers, you may ask? Let's hear it from the expert. Causes of peptic ulcers. Peptic ulcers are sores that form in the stomach or small intestine when stomach acid damages the lining. This can cause pain and sometimes bleeding. Normally, a protective mucus layer keeps the acid from hurting the digestive tract. But if there's too much acid or not enough mucus, ulcers can develop. Common causes. 1. Helicobacter pylori, H. pylori. This germ lives in the mucus that protects the stomach. While it often doesn't cause problems, it can lead to inflammation and ulcers. H. pylori might spread through close contact or contaminated food and water. 2. Pain relievers. Regular use of certain pain medications, like aspirin or ibuprofen, can irritate the stomach lining, increasing the risk of ulcers. Acetaminophen, like Tylenol, does not have this effect. Now that you have a better understanding of the topic, you can learn more about ulcers by consulting your local doctor or exploring reliable resources on YouTube.
What is the link between cayenne pepper and ulcer? We know that cayenne pepper is hot, and thanks to Barbara, now we know that pepper does heal internal bleeding and externally bleeding, but however, don't use too much of it. One other thing, you use it on an empty stomach if possible, and try drinking cayenne pepper water. What that does to the intestines and the ulcer is, once the cayenne pepper goes down, it will come into contact with the ulcer. And then cayenne will get into the ulcer on the stomach wall, and then thin the blood. At the same time, stop the blood from bleeding. You can also use cayenne pepper externally for a cut. Just applied it on the wound and it stopped the bleeding. Some people go a little bit further and use the cayenne pepper and slippery bark, or ulmus fulva as it call. The cayenne pepper use internal to treat ulcers, as the cayenne pepper and slippery bark works the same way. Cayenne, Capsicum annuum, is a medicinal and nutritional herb. It is the purest and best stimulant. It is an excellent food for the circulatory system, as it feeds the necessary elements into the cell structure of arteries, veins, and capillaries so that they regain elasticity. It also regulates blood pressure. Used most beneficially raw, it rebuilds the tissue in the stomach and heals stomach and intestinal ulcers. The opposite is true of cooked chilies. It also produces natural warmth and, in stimulating the peristaltic motion of the intestines, aids in assimilation and elimination. Cayenne peppers have white seeds, which are the hottest part. They are good for colds and flu.
For more information, go on the National Library of Medicine website. Abstract: in recent years, infection of the stomach with the organism Helicobacter pylori has been found to be the main cause of gastric ulcers, one of the common ailments afflicting humans. Excessive acid secretion in the stomach, reduction in gastric mucosal blood flow, constant intake of non-steroid anti-inflammatory drugs, NSAIDs, ethanol, smoking, stress, etc., are also considered responsible for ulcer formation. The prevalent notion among sections of population in this country and perhaps in others is that red pepper, popularly known as chili, a common spice consumed in excessive amounts, leads to gastric ulcers, in view of its irritant and likely acid-secreting nature. Persons with ulcers are advised either to limit or avoid its use. However, investigations carried out in recent years have revealed that chili, or its active principle, capsaicin, is not the cause for ulcer formation but a benefactor. Capsaicin does not stimulate but inhibits acid secretion, stimulates alkali, mucus secretions and particularly gastric mucosal blood flow, which help in prevention and healing of ulcers. Capsaicin acts by stimulating afferent neurons in the stomach and signals for protection against injury-causing agents. Epidemiologic surveys in Singapore have shown that gastric ulcers are 3 times more common in the Chinese than among Malaysians and Indians who are in the habit of consuming more chilies. Ulcers are common among people who are in the habit of taking NSAIDs and are infected with the organism Helicobacter pylori, responsible for excessive acid secretion and erosion of the mucosal layer. Eradication of the bacteria by antibiotic treatment and avoiding the NSAIDs eliminates ulcers and restores normal acid secretion.